Parasites can cause decreased growth rates and feed efficiency, diarrhea, poor doers, skin infections, and even death in severe cases. Parasites can be really difficult to control once the worm burden is high enough in a site. So it's important to kind of be constantly managing your parasites. Also, you can have condemnation at the slaughter plant if your parasite issue gets high enough. So the major parasites of swine, this, again, I'm just hitting the major ones. There's more that are out there, but I would say these are by far and away the most common stuff we deal with in the swine industry. So as far as internal parasites, intestinal parasites, Ascaris, which is the roundworm, Trichuris suis, whipworms. So external parasites, so Sarcoptes suis, which is mange, and Hematopius, which would be suis, the hog louse or lice. And then I'm also going to hit on Ascaris suis, which is coccidia, which is going to be a protozoa, but that could fit into this discussion. Roundworms, far and away the most common intestinal parasite of swine. In commercial herds, so pigs that live their whole life indoors, we find roundworms. Sow farms or commercial sow farms are almost always deworming for roundworms because they're so prevalent. The females can lay up to 1 million eggs per day, so a lot of worms. The eggs are actually sticky and are hard to clean up in the environment. They literally the eggs can literally stick to the walls and to the floors and that sort of thing. So very difficult to clean up, very difficult to get rid of with disinfectants. Your environment very easily becomes contaminated and will probably always be contaminated. And the eggs can survive in the environment for a long time. So from an evolutionary standpoint, these worms are pretty awesome. So they'll probably survive the apocalypse.
Does bleach kill them?
I don't even think, as far as the survivability goes, I think they are resistant to most all disinfectants, at least for the most part. I don't know if they're completely resistant to bleach or not, to be honest with you. I mean, I know you can certainly killing off some with any of those disinfectants or bleach. You're not killing all of them. As far as like a percentage of kill, that's a good question. I don't know the exact answer to that, but I know you can almost never completely get rid of them, probably unless you're torching the whole place. Good question though. So roundworms affect all ages of pigs. The clinical signs are generally a lot more severe in your young growing pigs. So poor growth rates, rough hair coats, coughing, thumping. Obviously worms coming out of the behind is a good clinical sign. It's always something fun to see. Let's skip the. Actually, maybe we should talk about the life cycle for a little bit. So, so these were, it's a fecal oral transmission, just like most parasites are. So the pigs eat the worms in the environment. They pick up the worms in the environment. They migrate through the liver and the lungs, which is why I'll show pictures of. You can have what we call milk spots, which are white spots on the liver, where the worms are literally migrating through the liver. They go through the lungs and are actually coughed up, which is the reason you see them coughing. And they're swallowed, go back through the intestines, and then are passed through into the feces there. So, as far as grossly, and they generally live in the small intestines. You can cut them open, you could find them in the small intestines. These are the milk spots that I was talking about on the liver. Just essentially scars from where the worms migrated through the liver. So that would definitely get condemned at the slaughter plant. You would lose your money on that one. Whipworms. So this generally affects pigs about 6 months of age or younger. These are worms that live in the large intestine or colon, and they can do really a lot of damage to the gut. So they can cause pigs to be off feed, diarrhea, usually with blood. These pigs can really become dehydrated, and you can see acute death in severe cases. It's important to note, so you won't see the worms in the feces. At least you never will. On necropsy, occasionally I will find them when I actually cut open the colon there, but they live in there. They're not going to migrate out with the stool. So you're never going to see these unless you're cutting them open and looking. As far as treatment of intestinal parasites, so a couple options: feed, injectable, and through the water, which is pretty nice. So probably one of the most common ways is using a fenbendazole product. So Safeguard is going to be your big one. As far as injectable, there's ivermectin in the ivermectin class. So ivermectin and Dectomax are going to be your big ones. And then in the water, this is a relatively new product. It's still fenbendazole. It's made by Merck, they make the Safeguard as well. This one is called Aquazole. So that can be administered through the water medicator. Actually, some of my ABF guys are actually doing like what you were describing with the big, mixing up the D-gallon drum and mixing the Aquazole in there. So several options there, which makes it nice. There's a lot of ways to kind of tackle it. What's the best option? Probably just depends on your farm. So and ease of administration. So controlling it. Big thing you want to try to tackle is limiting the amount of worms from the sows to the piglets. So everybody's going to have worms. The thing you're trying to do is decrease the number. Your numbers are not going to be zero. You're just trying to keep the burden low, keep the issues low. So decreasing the amount of worms that go from the sows to the piglets will hopefully keep the downstream numbers lower. So that generally entails deworming sows up to 10 to 14 days pre-farrowing. Ideally, not in the farrowing crate. So I know it's easier a lot of times to do that. You know, they move sows in the farrowing pens a week or two before. They want to medicate them there. It's best to do it like if they're out in a different pen or out in like a gestation area or whatever, away from where they're going to be farrowing. Because if you're going to medicate them in the farrowing crate or farrowing pen, they're just going to be shedding out the worms right into those pens. So ideally, you're doing that in a different spot than where she's farrowing.
And how long does it take for the medication to get through, kill the worms, and be eliminated so that you can move them into farrowing?
So the treatment depends what you're treating with. An injection is just a one-time injection. The Safeguard and the Aquazole is usually I recommend about a 3 to 4 day administration of that product. So I like to wait 2 or 3 days after you finish the treatment before I move them in, because usually once you're giving them, they're shedding them out pretty quickly. Good question. If you have a little bit more time, that's even better, but sometimes you can only do so much. So, good question. Also for control, growing pigs, it's important to keep the worms down low in them. Most people tend to do something a little bit earlier at weaning or a little bit after, and then go on some sort of a regular routine schedule every 6 weeks-ish. Sometimes it just depends on how bad they perceived burden is or how bad they think the worm burden is, what's feasible for your facility, that sort of thing. Also, like we talked about sanitation to reduce environmental contamination, always a good idea. Changing out bedding. Should be done on a routine basis regardless, but changing bedding between groups, that sorts of thing, just to help keep your worm burden lower.
What about coming up with any kind of resistance? Are you worried about resistance?
That's a good, yeah. So the question was about resistance. That's a great question. Knock on fake wood. What was this? So resistance is definitely a big issue in our small ruminant world. Probably some in other species. Today, we're not really seeing drug resistance with dewormers. So, yeah, in the small ruminant world, lots of times you're changing your class of dewormers, you're rotating dewormers just because of resistance. Doesn't seem to be an issue so far in the swine industry. Hopefully, it does not become an issue. So, yeah, using the fenbendazole class, the ivermectin class, seems to really take care of the worm burden and do a good job.
Is that more because it's a monogastric?
No, I don't know. Let's Google. I'm not sure. I don't know if we really know, really. So just from a sample protocol, again, this is a really basic protocol that I would give a client. So anytime you're bringing new pigs in, probably the easiest thing would be, an injection for most people. So an injectable ivermectin shot when you're bringing in new breeding stock into your facility. Good idea. And then sows and gilts, 10 to 14 days pre-farrowing, either an injection or doing that Safeguard Easy Scoop, which you can, usually just top dress right onto the feed there for 3 days. This one for growing pigs, you get the option of either an injection or some Safeguard 2 weeks post-weaning, and then they're pulsing again at 120 to 150 pounds of body weight with feed grade Safeguard. Again, you could do the Aquazole in this point in time as well. Just depends, the water medication just, again, depends a lot on your facility. They're all good. I would say they're all good drugs. So.
Does the Safeguard in the water warmer, does that kill external parasites?
No, good question. Yep, good question. The question was, does the Safeguard in the water protect against external parasites? No, it does not. So we're going to get into external right after this. That you're going to need an injection to take care of any of the external parasites. So Sarcoptes suis is the mange mite. So these mites burrow underneath the skin. You cannot see these unless you look at them underneath the microscope. So, and they're transmitted pig to pig. They jump around from pig to pig. They live in the environment for just a little bit, not very long. They don't generally persist in an environment for a long period of time. They can bite us. They don't like us that much, so they can bite, but they don't like to live on us, which is a good thing. They're just about every species has some type of mange mite, and it's specific to that animal, which is a good thing. So the Sarcoptes suis likes pigs, lives on pigs, stays on pigs. The mange mite that your dogs might have. They're not going to be going back and forth with each other. They might bite, and then realize, oh, hey, that's not a pig, but they're not going to be living on other animals for long. So just species specific with mange mites. So also good to know for your kids going to school that they're not going to be bringing it to school. I get that question a lot because I see this a lot in 4-H pigs. So they might bite them, but they're not going to live there. So clinical signs, itchy. I mean, they are so itchy when they get this mite. Scratching on posts, scratching on just about everything. I mean, pigs are going to itch a little bit here and there. That's normal enough. But if you're walking around looking and, almost everybody in the barn or most of your pigs in the barn are scratching and itching on something, you should get a vet out to check because you might have the mange. But it is pig to pig. So lots of times the story is, oh, I brought in a pig from wherever, maybe New Holland, and everybody's itching now. So also in the skin, irritation, red bumps, hair loss from scratching. If it gets severe enough, they can get lots of secondary skin bacterial infections. If they're really scratching at themselves, they can cause that. So it doesn't normally, but if they're really scratching at themselves, it'll cause secondary infections too. Not very uncomfortable for them. Hematopoiesis suis, so that is the hog louse or lice. These you actually can see. You can visually see these. And lots of times they usually like to live around the ears, but they can go anywhere. That's usually where I see them. Don't see these too much anymore, but every once in a while I see one pop up. Clinical signs very similar to mange, itchy, uncomfortable, skin irritation, that sort of thing. You can actually visually see them, which is your clue that you got it. Transmission's the same, pig to pig. Control, so this does need it would have to get an injection. So in your avermectin class, doramectins or ivermectins, actually I think there's been some research done that show that doramectin's probably a little bit better at doing the job. But honestly, I have plenty of clients that have used this and have been successful. But the avermectin class is your big thing. So the big thing with this is your treatment needs to be 2 injections, so 2 weeks apart. So 1 injection When you figure out you got it, and then another injection 2 weeks later, you have to do this. So, and that's because the mechanism of these drugs, you're killing the adults. They don't have the ability to kill the larvae or the eggs. So you're killing the adults. What's going to happen in a week or so is you're going to have rehatching of the larvae that's already on there. So you have to kill those too. So you have to do 2 injections. I can't tell you how many times I get phone calls about this, even though I tell people, you've got to do the 2 injections 2 weeks apart, otherwise you're going to have it again. Because you're going to get better. They're going to get better after the first shot, right? You're going to be killing those adults, but they're going to come, the larvae is going to erupt. So also the important thing is with this as well, it transmits from pig to pig, right? So even if you only are seeing a couple pigs scratching, you need to give everybody, you need to treat everybody on the farm. And a lot of people cringe when I tell them that, but it's true. It jumps from pig to pig, so they're going to be just jumping to the next pig that hasn't been treated if you don't treat everybody at the same time. So,
a couple of questions.
Sure.
So the lice that we're seeing on hogs, is that species specific?
Yes.
And I don't keyword.
Oh, sorry. Yep. The question was, is the lice species specific? Yes, it is.
Okay.
Yeah.
And then I guess the second question, again, specific to lice, is there any sort of external, like, quick fix, like clipping pigs or applying something topically? I had a producer over the summer that got rejected from the fair for lice, and they can inject, but still you're looking at a couple weeks, and they had asked if there was anything, like, what can we do right now?
Yeah, it's a good question. So the question is there any sort of quick fix for lice, or really probably even mange? And the short answer is no, there's not. I mean, you can manually try to pick those adults off, or if it's lice, because you can see them. They kind of like ticks, the small ticks, but you can certainly pick them off, but they're still there. The larvae are still there. They're burrowed into the skin. So, unfortunately, you have to inject them. There's no, what in cattle, so you can get those pour-on. Everybody asks me, can I give them a pour-on from the cattle? They want to put the pour-ons down the back. I wish you could, but you can't. It's not going to work.
So why? Does it work? The permethrin?
Yeah, it doesn't. Yeah, I don't remember all the pharmacology anymore, but yeah, from the mechanism of action standpoint, it just does not do the job. I wish you could, but you can't. Make life a lot easier, make people a lot happier. But nobody's been able to develop it. I think some of that might even have to do with the skin, if I remember, like the actual skin absorption in the pig compared to other species. But I can't remember completely.
Like hair coat or something.
Yeah, it might be. Yeah, it might have something to do with like the follicles and the absorption in the skin there. But I don't remember anything.
And that doesn't work for mice. Mice, it just works for lice on cattle. It doesn't, if they have.
Oh, I don't remember. Yeah, that's a
Yeah, the permethrins only work for lice.
For the lice, yeah. I don't remember anymore. So, but do you guys see a lot of lice up here then? Or I only see every once in a while. I see.
I heard of it.
Oh, okay, yeah. I see a lot of mange, but gosh, I can think of 2 or 3 times where I've seen lice. Doesn't seem to be as common anymore. At least around our area. So, okay. And this a little bit off topic, but kind of fits in coccidiosis. So that is, it's not a bacteria, but it's a single cell protozoa, parasite. So this is a pretty common cause of diarrhea in pigs. 7 to 21 days of age. So based on the life cycle of this protozoa, you're not going to see this in pigs less than 7 days of age. So it needs some time to become infectious. So if it's 3 days old, it's not coccidia. So 7 to 21 days. It has a pretty distinct like yellow-gray color to the diarrhea. I actually think it kind of has a distinctive smell, which I can't really describe, but you just kind of know it when you smell it. You've been in enough pig barns. So not effective against, or antibiotics will not be an effective treatment with this. So generally, sometimes people do nothing if the problem's not that, prevalence is not that severe, but there's a preventative measure to use a coccidiostat. So the most common thing we use is actually panazeral, so Marquis, which is actually an equine drug. And so it's an oral dose, so it's squirting directly into the pig's mouth at 4 days of age. So you're doing it before you're, seeing clinical signs. And sometimes we just do that routinely at farms that are having kind of persistent issues. Usually coccidia by itself, you really shouldn't be having high mortality. You should, it doesn't usually affect the pigs terribly much. I mean, sometimes if you have other issues, they might be more sick, but it's kind of one of those where it's mostly subtle, maybe causing a little bit of sickness. But sometimes if I'm dealing with coccidia and they have consistent E. coli issues or rotavirus or something like that, then maybe this is exacerbated a little bit more. It can make pigs a little bit sicker, that sort of thing. So in those cases, those are the people that are probably doing more of the preventative treatment. So just it kind of depends on the situations. But in a healthy herd by itself, sometimes a lot of things you just kind of find it or you deal with it a little bit, and we're just kind of deal with it. Keep the pigs warm, keep the pigs dry. Doesn't send them back too much. Just depends. There is, you'll read about treatments. Every once in a while I see articles about it, or some people talk about treating the sows to try to help with coccidia. Really a lot of the scientific research will tell you that not all that helpful. Like there's a improlium, which you can give to sows pre-farrowing. A lot more of the research on that says probably not that effective. You're probably really not doing that much to help.
And improlium to the piglets doesn't.
That's not nearly as good as doing the Panazerol to them. Yeah. And I can't remember, because the girls at the office will take, because what does it come in those big tubes, and I can't remember the dose off the top of my head of what because they just kind of dose it out into smaller bottles. But I can find that out if somebody needs to know the dose. I can't remember how many milligrams it works out to. Because don't follow the label on it. But there'd be nothing small enough really. But I can find that out. I think that's That's all I've got on parasites. Any questions or discussion?
That marquee is a paste?
Yeah, it's a paste.
So coccidiosis, that's a protozoa that lives in water.
Mhm.
And if you're raising cattle, you just put the corid or amprolium into the water tank and follow the protocol. But cows have gush blood.
Yeah, it's a different,
Really sick, is it?
It's different. Yeah, very different. Yeah, species specific for this one. Yep. So this Sosperus suis is the coccidia that affects pigs. There's you can find a Imeria species that is actually just like incidental. If they find it on fecals or something like that, doesn't cause disease at all in pigs. But it's completely different. This is very devastating in the cattle industry. In pigs, very mild disease. So it's a completely different beast. Yeah, fortunately. Yeah, because I know. Yeah.